Now the scenario number 8 is a chronic condition greater than 3 months, scanty and foul smelling ear discharge, hearing loss, bleeding from the ear, marginal perforation, cholecystoma, granulations, complications, intracranial or extracranial. So what can you think of? Yes, it is chronic suppurative otitis media, aticoantral type. This is also called unsafe ear because of cholecystoma and granulations. Cholecystoma causes bone erosions, complications that are intracranial and extracranial. So it is called unsafe ear. And because of cholecystoma, there is also erosion of the blood vessel as well, which causes bleeding from the ear. And this is an aticoantral type of CSOM. As you can see that it involves the attic region and the antral region. This area and the attic region and the antral region. Now the scenario number 9. There is pain behind the ear and swelling. There is fever and there is purulent ear discharge. So what can you think of? Yes, it is a case of acute mastoiditis. Acute mastoiditis is basically a complication of acute suppurative otitis media. So what is the pathophysiology of acute mastoiditis? Acute mastoiditis results from when bacteria spread from the middle ear to the mastoid ear cells, where the inflammation causes damage to the bony structures. Remember that acute mastoiditis is a complication of acute otitis media, and chronic mastoiditis is a complication of chronic suppurative otitis media, and it can be caused by chronic suppurative otitis media tubotympanic type, chronic suppurative otitis media aticoantral types. And this is a picture showing acute mastoiditis. As you can see, the post-oral swelling. This is the post-oral swelling, and you can see that because of the swollen area, the ear is turned forward, and these are the mastoid ear cells where infection is taking place. Now let's come to the scenario number 10. A female or male, most commonly female of age 20 or 20 in 20s, comes with a painless progressive bilateral conductive hearing loss, and she might present with paracusis volici, which means that she may hear better in noisy environment. Her speech is soft and low volume speech, monotonous, well modulated. These all words can be present in the scenario. The tympanic membrane and eustachian tube is normal, and this is a hereditary condition, means that it is also present in the family. The brother or sister might have it. So what can you think of? Yes, it is a condition of otosclerosis. Paracusis villi again, ability to hear a conversation better in noisy environment. So as you can see that in otosclerosis there is overgrowth of the bone here. Most commonly it involves the stapes. This procedure removes this excessive bone is stapedectomy, which is the or stapedectomy. So the scenario number 11. The symptoms appear suddenly, and on attempt to close the eyes turn up and out, which is known as the Bell's phenomena. There is dribbling of saliva from the angle of the mouth, face is asymmetrical, and there is epiphora. Epiphora is basically the excessive tearing due to the lacrimal pump failure or due to the nasolacrimal duct obstruction. And he or she also has noise intolerance and loss of taste. So what can you think of? as apparent from the symptoms, and as I told you that it is Bell's palsy. As you can see in this picture that there are droopy eyelids here, and the facial paralysis, twitching and weakness here, and there's a drooping corner of mouth, dry mouth, and impaired taste because the facial nerve also supplies the salivary glands and all that, and also the tongue. Scenario number 12, there is episodic vertigo. There is fluctuating hearing loss, which is unilateral and sensorineural hearing loss. There is tinnitus, ringing sound in the ear. There is sense of oral fullness. There blockage, and on examination there is nystagmus to the unaffected ear. So what can you think of? All these conditions point to the Menieres disease, which is also known as endolymphatic hydrops. Now there is excessive fluid which causes swelling and pressure, and the swelling distorts balance here, semicircular canals which are responsible for balance, and the cochlea. Now the distorted balance information and distorted sound information goes to the brain, and this distorted information is responsible for the symptoms that are described before. Episodic vertigo, fluctuating hearing loss, tinnitus, sense of oral fullness, on examination, nystagmus to the unaffected ear. So Meniere's disease, endolymphatic hydrops. Scenario number 13. Slow and progressive hearing loss, pulsatile tinnitus. On otoscopy, tympanic membrane with red reflex and rising sun appearance. This is characteristic sign. What can you think of? This is a glomus tumor when it is intratympanic. You can see it on the tympanic membrane, the rising sun appearance. Now there is a hearing loss and tinnitus. History of profuse bleeding, either spontaneous or on attempts to clean it. Dizziness, vertigo, facial nerve paralysis. Now what can you think of? Yes, it is a glomus tumor when it presents as a polyp. So glomus tumor can present in two forms. When it is intratympanic, it is present in the tympanic cavity, middle ear cavity, or when it presents as a polyp through the tympanic membrane into the external auditory canal. The polyp is supplied with blood vessels and it can bleed. Now you can see that this is a rising sun appearance. You can see the pulsatile red mass behind the eardrum here. This is the rising sun appearance. As you can see that it is rising like a sun. The rest of the eardrum is normal. Scenario number 14. An adult of usually of 50s, progressive unilateral sensorineural hearing loss, tinnitus, difficulty in understanding speech, and there are some compressive symptoms associated with cranial nerve 5, corneal hyposthesia, midface hyposthesia, and cranial nerve 7 involvement. Cranial nerve 7 involvement include loss of taste, decreased salivation through checked through Schirmer's test, and all other symptoms that are associated with facial nerve paralysis like facial weakness as well. Cranial nerve 2, 4, and 6, which are associated with eyes, sight, diplopia. So what can you think of? It is an acoustic neuroma. Acoustic neuroma arises from the cerebropontine angle, and it is a benign tumor of the acoustic nerve, eighth nerve, and where it arises, it compresses the adjacent nerves. Remember that it arises from the cerebropontine angle, and it is the most common tumor that arises from the cerebropontine angle. You should also differentiate it from the other tumors that arise from the cerebropontine angle. Now, scenario number 15, a child sleeps through loud noises uninterrupted. He fails to develop speech at 1 to 2 years of age. So, what can you think of a child which cannot be awoken by loud noises and he fails to develop speech? He can't speak at even 1 or 2 years of age. Yes, he is a deaf child. Scenario number 16. There is progressive bilateral sensorineural hearing loss, and the person is old, and there is also high frequency loss on audiogram. So, what can you think of? Yes, it is a case of presbycusis age-related bilateral sensorineural hearing loss or hearing loss. Now, a patient has progressive bilateral sensorineural hearing loss, and there is occupational noise exposure, and similarly, like the above case, high frequency loss on audiogram. So, what can you think of? Yes, it is a case of noise induced hearing loss.